Hi, it's Dr. Ginger Bratzel with you, and we're continuing on our 6 ways to increase new patient conversions instantly by using the assets you've already have within your office and just repurposing what you've already invested in. Today we're going to go on to number 3, the new patient interview. Historically, when a new patient comes into an office, the patient might have received an information package from you in the mail ahead of time, which I strongly recommend, but more than likely, they come in and you hand them a clipboard, and that's a real impersonal way to start things off because the whole perception is to make yourself different, make yourself stand out from the crowd. So this approach is historical, and it'll send the message, yeah, they're like everyone else, it won't shock anybody. But instead, I urge you, instead of just handing them that clipboard, what about an interview style where we go through the paperwork with them? This is our opportunity, and when I say we, our staff members would be doing this, but it's our office's opportunity to find out what's really driving these people to come in. What brought them in? They might say, I don't like my face, I don't like my smile, I don't like some part of my body, something cosmetic, but to find out what that means in their terms so you both can have a full understanding what is possible, what they want, and so the outcome's better. It's a form of relationship building. And, you know, think of it to comparison to blind dating or internet dating. You fill out a form, if that's all you did to match up with somebody, it wouldn't be a really personal relationship. And we are in the relationship business. We are in the people person business. So to know where they're coming, you know where you want to take them. So by asking them open-end questions to find out what they want, why are you here? What brings you in today? Well, I don't like something. I don't like my smile, or I want it better, or I want to look younger. Tell me more. We want to know what that means to them. Looking younger to one person might be something to another person, including ourselves. Even though we treat thousands of patients in our offices, each person has a different way of defining them. When someone comes in, I don't like my teeth. Well, what does that mean? Tell me more. What does that mean is kind of a confrontational, but tell me more. Well, I don't like the color. I don't like the shape. Or I don't like the lines around my face, or I don't like my nose, or I don't like my thigh. What does that mean about it? Well, what do you not like about the thigh? Well, I don't like the lumpiness and a pudge here. I don't like my love handle here. And it gives us better pinpoint ideas of where we need to be doing. And then, as I already said, it's a bridge for forming a connection. The most important about the new patient interview and the new patient experience is team driven. This is not doctor's time, which is very productive, very precious. We're getting all this information and building that relationship using the assets of our team. And the easiest way to really build that bond with people, and this is with anything, this is not just a new patient interview, but when someone goes on and says, I don't like X, Y, and Z, or I want X, Y, and Z, you simply say, and when I say you, I mean the staff member, let me make sure I got this right. And then state back what they said, word for word. Don't paraphrase. That was a common teaching pattern. Paraphrase and change it into your own words. Because when you change it, you lose the meaning for them. Say it right back to them in the same tone they said it to. Because what that shows them is like, oh my gosh, they listen. They really get it. And it forms this magical connection. And think about it in your relationship when you've really connected with somebody, when they understood you. And it might be you thought you just had a natural connection, but they just were on the same wavelength as you. This is the quickest way to get on the wavelength with these people, is stay right back to them and take it note for note. Don't change anything, what they want to say. Another important thing with any new patient experience, because they can be time consuming if you don't have your systems in place. And the whole purpose of the new patient interview is to gain insight into how they feel about their situation and how they see it in their own terms. So at the end, we're better in the position to know what they expect. It also opens the doors for possibilities. They might have came in for X, but listening to what they want and getting all the information, they might be better suited for Y. And without those information, how can we really fully serve our patients? So get them involved. When you're going through and getting the new patient, you got the verbal history, but as you're going through collecting the information, so if it's a dental office, you're taking x-rays, verbally tell them what you're doing. You're planting the seeds. If it is a cosmetic surgeon office, what are you doing? What assessments? What photos are you taking? How you're gaining your data? So nothing's a shock to them when the doctor comes in. It's commitment and consistency. You're getting them to agree about what's going on in their life, their situation. You weigh X amount. Yes. Your teeth are X color. Yes. And yes, yes, yes. When people are on a path of saying yes, it makes it easier for them to take that commitment at the end, which is accepting treatment. Because you have made the connection, you walked them down hand in hand down the path of case acceptance. It gets their mind in the game and just make sure they know what's going on. As I already said, get them invested in their own care mentally. When they look in their mouth for cosmetic dentistry standpoint, they thought they might be X, Y, and Z, but when you show them what other things are going on because you've been talking to them all along, they're like, oh, things are worse than I thought. When they get a magnifying mirror or a magnified photograph of their face, oh my gosh, I never saw that wrinkle in there. My lights must be really bad in the bathroom. Oh my gosh, that gets them seeing things the same way you are. Case acceptance, to get people involved as far as just your team being able to do it and the patient being able to accept it, it has to, with verbally letting them know what it is and involving them in it, you build value into your words and value into what you're doing. And you also need to keep it simple. Simple for your staff to do through systems, and simple for the patient to understand. If you overwhelm them and give them too much information, we could do X, we could do Y, we could do Z, we could do D, too much choices. People can handle 2 rules and they can handle 2 choices. So keep it simple for everybody involved. If you have a system in place, it's the same for your team members time after time after time. There's nothing more to alter. They know it and they do the one thing. It gives people to accept more care because they're on the same wavelength. It controls your time because you have a system and a schedule that it goes the same each and every time. And we've already talked about how precious the doctor's time is. We don't waste any of that. And when the doctor comes in there, essentially you're the second opinion. The patient's already come to the conclusion they need more than maybe they thought because they're more aware of the situation. The staff's been educating as they go along. They're not teaching them in medical or dental terms, but they're educating them to let them know where they are in layman's term. So when the doctor comes in there and says, you need, Mary, I would really recommend this procedure for you. They're ready because you are just confirming what they already knew in their head. They know the severity of the situation or the non-severity. It gets them all in the right place. So this is important, very important. The most wasted asset I find people doing is with their teams and staff. They're wasting the investment by not having the systems in place to make that connection, to have that new patient experience, and just further down the road of everything we talked about, the phone, the office, the appearance, everything, to making people understand where they're at and make them in a position where they're more likely to accept the care you're recommending. Again, this is Dr. Ginger Bratzel. It's been wonderful being with you, and we'll look for our next installment. Take care.